Hello, everyone. Welcome. I'm James Milan, and I am here for a weekly COVID update, but not with the person we're usually speaking to. That would be Town Manager Adam Chapdelaine. But this week, we are pleased, really, to welcome the Director of our Health and Human Services Department here in Arlington, Christine Bongiorno, who we have been wanting to talk to for a long time now. Christine, thanks very much for carving a little bit of time out of what is always a crazy schedule for you
Of course.
to talk with Arlington Public.
It's great to be here. Thank you so much, James, for the opportunity.
We really do appreciate it. And Adam and I always begin, and I want to start in the same place with you, and that's looking at the stats here in Arlington and putting some context and putting those into perspective. As I always do, and I was mentioning to you before we went on camera, I looked over the stats over these last, the town's website presents Arlington stats in 5-day increments. And I went back just about 15, 20 days here. And I am struck by a couple of things I wanted to ask you about. First of all, the numbers are rising, as we are well aware, and we'll talk about. But the two things that struck me the most, one is that there was a real surge, mini surge, at the beginning of this month, December, the first few days of this month, that 5-day increment, and then it really seems to have slowed in the last 5 days. Is that just the vicissitudes of how this pandemic is working, or is there something that we can take from that? Can you put that into perspective for us?
Sure. Well, what we know is, just sort of backing up, this is the novel coronavirus. This is something we're learning every single day, new information about. But what we do know for certain is that the best way to spread this virus is gathering, social gatherings. And what we know about the week before the first week of December was that it was Thanksgiving. And although the message to the community and to the public from the top down was limit your social gathering that for that holiday weekend, and although the message was sent, many people still decided to travel, gather with family members, and so what we saw as a result of that was just an increase in cases and a demand on our testing system, a demand on our local public health contact tracing system. So we did see a major surge as a result of that. From there, what we saw was, we saw 15, 17 cases a day for a few days. And we sort of saw just a little bit of a lull, but now we're starting to see it pop up again because people that may not have actually been symptomatic or had access to testing may not have gotten tested, so we weren't putting their contacts in quarantine. So now their contacts are now becoming positive, and so we're starting to see more of that, like that additional spread as a result of people that may have been positive, didn't know it, and they're out spreading it. So we're starting to see it creep up a little bit more. And so that's sort of where we're at. So it's the social gatherings that we're really concerned about over the course of the next few weeks, as well as we head into the new year and just the end of year celebrations and holidays that people gather for. So, again, it's that direct link to that social gathering piece that we are seeing linked to the higher case numbers. And just, with that baseline higher cases, we're going to start seeing it sort of rapidly increase over the course of the next month or so.
Yeah. My second question, and thanks for that, has to do with, and this is also connected, I think, to the fact that we will be talking about vaccine rollout shortly. But my second question is, I was really struck by the fact that we all are aware that in addition to frontline healthcare workers, the population that is likely to get that vaccine soonest is our elders in senior care facilities, basically. So I'm struck by the numbers here in Arlington, which consistently now for quite a while, and including through this recent surge, which makes sense in terms of what you just said about family gatherings, et cetera. These folks are in our local elder care facilities, I assume, but that 70 to 90 age range, the numbers are very, very stable there, where they have been surging in other age groups. Um, and is that, I don't know, does that does that color, what our priorities here in Arlington might be once vaccines arrive? You know, clearly our elder care facilities are doing a good job of protecting their residents. But I wonder if you have anything to share, any insight to share about how those numbers, stable as they are, will play out, currently and in the future.
Sure. So what we learned in the spring was just that population in those facilities really, the virus can spread so rapidly with some standards that we could put in, some strategies we could put in place to limit the spread. We were able to kind of control it a little bit, and these facilities we've learned a lot over the course of the past 9 months. The state has put a lot of restrictions in place, but what we know is that this virus will essentially, fly through these places, and the complications are much riskier for that particular age group, and people in those facilities because of their comorbidities, their health conditions. But we're starting to see is more hospitalizations in the 60 to 80 population as well, with pretty complicated outcomes as well. So I think that we may see that the younger populations, the 0 to 19, and then the 20 to 29 age groups are, we're seeing those as like our biggest numbers over the course of the past few months. What we are most concerned with are kind of the cycles of spread, right? So like those people are gathering with their friends, and they're gathering with their parents, and their parents gathering with their elderly grandparents, or parents and grandparents. And so like that's the flow of how disease spreads within a community. And so we've always, like, from examples from flu vaccinations, we've always vaccinated in the schools to prevent that spread and that jump to the older group, which could have more complications. So we do know that the vaccine rollout that the younger population is vaccinated in order to prevent that jump into that older population.
Great. I know we have a bunch of other topics to cover, so I just wanted to ask one last thing about our local numbers, and that is do you want to put them into perspective, given that you are our local expert here? How is, from my conversations with Adam going back, months now about this, we feel like Arlington is doing well, relatively speaking. What's your perspective?
I have to agree with that. So, I think in Arlington, people are compliant with the requirements for masks. We're not walking around seeing many people without masks. We have an enforcement team that go out on a periodic basis, working with residents, working with businesses, and so we're seeing a lot of mask compliance. Masking is a really important piece to prevent the spread. It's really when gatherings are happening. We meet. I'm sure Adam has explained in the past. We meet daily and talk about where are our numbers, what can we do to limit to prevent the additional cases. And so we're always trying to strategize on locations where we can kind of tighten up. And so, I think our team is amazing and has done a great job at looking at that. And we were sort of ahead of the curve when it came to requiring masking. We require masks in additional locations that may not have been required in the past. So, I think, locally we've done a great job. And I think that we have a population of people that are really, up on what it takes to prevent the spread. Other parts of our country, we don't see that. And I think even other parts of our state, we're not seeing the compliance rate. I think there's also another piece to it, in that we are a community where people have the privilege of working from home. And so when we look at communities, and this is really like when we in public health, when we look at health and health equity across communities, Arlington, has a bit more residents that have that luxury of being able to work from home, whereas a community where there are a lot of essential workers that maybe are janitors in hospitals, or are delivery people, working in grocery stores. I think when we look at Arlington versus a community with people that can't work from home, like, we're going to see lower rates in an Arlington versus a community that may have a lot of essential workers that, that we'll see higher rates in those communities. So I know that the state's done an amazing job at really focusing funding and energy on those communities. So I think. So, sorry, go
Well,
ahead.
I mean, I just want to say we're going to move on, but that's a great point because, we can take some credit here in Arlington. I agree. Anecdotally, it's been clear, mass compliance very high. In general, people behaving responsibly, it feels like. Secondarily, though, we have to acknowledge our privilege, and that's a huge part of things here. So, duly noted, and thank you for that. Moving on, everybody is anticipating the rollout of the vaccine. Tell us what you know.
So the vaccine rollout will happen in various phases. What we do know is that the first phase will go to the highest risk individuals. So people that are working directly with COVID patients. So hospital workers, people that are working, from the nurses and physicians, respiratory therapists, to the people that are delivering the food and the people that are cleaning the rooms of COVID patients. So they're really looking at who in the hospital is most at risk. So those are the first round. The second, within that first phase, they're also looking at long-term care facilities. So people that are working in those areas, as well as the patients, the occupants, the residents in those facilities. So, looking at the highest risk people that will have the highest chance of not surviving if they get COVID or having major health complications. So that's the first grouping. And then there are other groupings as well. And, I think I don't want to get too ahead of it because I feel like the vaccine hasn't been released yet, and we want to see how it comes out and the timing of it, because it could be delayed and it could, there could be maybe not enough to hit that part of the population. So, I think, everybody can look at the list and the phases and the dates and timeline, but I think, it's for us here in local public health, it's really one step at a time.
Yeah, it's clearly going to have to be because we have all heard, hey, there could be problems with distribution, and those are words that just fly by. But I think we're gonna know what that means soon, and that a lot of those problems might be predictable, some of them not. Um, I'm talking to you on the last of 3 days of testing that has been happening here in Arlington. How has that gone?
It's gone well. So we saw a need last week. We were hearing loud and clear from our community, and in fact, I had a personal experience trying to access testing. Whether it's through the physician, local urgent care, or one of the Stop the Spread sites, which the Stop the Spread sites are amazing. They're free to any Mass resident, but the access was limited because there was just such a high demand. And so what we saw was that our residents were getting frustrated, weren't getting tested, may have had symptoms. So we decided that we would open up a site. So we worked closely with our local ambulance providers, so Armstrong Ambulance, small business here in our community. We set up a site, and they've been running a lot of the Stop the Spread sites, so they know how to do this. It was fantastic. It went really well. Unfortunately, here in Arlington, I've requested a number of times, can we open a Stop the Spread site in Arlington, Lexington, one of our communities in the region. And again, it goes back to health equity. Arlington, Lexington, Belmont, we're not seeing those cases. So the state really says, no, I mean, it makes so much sense to us. So we stood up a site. We had to charge because, of course, we weren't getting state funding to run this. And then we had scholarships available for people. And there were people that took advantage of that, which was great to be able to provide that. So over the course of the 3 days, we tested about 200 people. Today's the last day. So, we've had a few positives, which is good to get those people out of the flow and out of the community and isolated in their contacts in quarantine, so that we can prevent the future spread, the further spread. So it's been going well. It was a pilot, so we're looking at whether or not we will be standing this up again, or if the additional capacity at the Stop the Spread sites that the governor announced on Monday, if that additional capacity will help alleviate the demand and the need for testing for our residents. So
Great. I think one of the aspects of dealing with the pandemic that people understand least, because testing is clear enough, compliance with protocols, people do or don't, but it's clear what should be done. I think people are confused about contact tracing. And can you kind of walk us through what is involved there, so that people have a better idea?
Sure, absolutely. So contact tracing is not a new phenomenon. It's not a new concept here in local public health. We've been doing it for years around all different types of infectious disease. So what it is, we get an announcement, we get notified of a case of a disease. So in this case, COVID. We look at, the individual. We contact the individual. We determine who they've been in close contact with for the time that they would have been infectious, that they would have been spreading the virus. So then we get that list of people, and then we start calling them and placing them under quarantine orders. So it may seem a little a little complicated, but it's a very simple process. The science has shown over the course of the past 9 months that the quarantine has gone from 14 days down to, if an individual is not symptomatic from the beginning to the end, that they can actually come off quarantine a little earlier than the 14 days, while also continuing to monitor for symptoms of the full 14 days from the last date of exposure to the individual who was positive. So it's a process that we use to prevent the additional spread of disease within the community. And again, we've been using it for decades in local public health to control polio or measles or any virus that could spread. And so, it was something that we were able to scale up quite quickly here back in February, March, when this all started. So
How has it been going locally? Because I hear about, the situation in other parts of the country where, a big problem is the fact that contact tracing means making contact with those contacts, and that people just won't answer the phone or, respond to that initial outreach from public health authorities. How are you finding?
yeah, I mean, I think it's challenging for sure. I mean, I think people they realize, if I'm positive and I share all my contacts, what we've seen is a lot of people want to tell their contacts themselves, but what that really does is it fails to prevent the further spread. So, if someone says, "Oh, I was," we really need local public health to contact that individual who could be at risk in order to fully explain the risks involved, what they need to look for, the days that they need to be quarantined for, the days they need to be out of, the public, basically. So we do struggle at times. It's not always easy. We don't always get all the contacts. And so it can be frustrating for us at times, but I think for the most part, people have really come to realize that the way we're going to get out of this is by sharing the information necessary with local public health in order to control the future spread.
Um, One thing I think everybody is aware of over the last few days is the governor's announcement that we will actually be taking a step back in the state with the surge of cases, and rolling back to phase 3, step 1 from step 2, and I think that's as of December 13th, this coming Sunday. What does that mean for Arlington?
So it means scaling back in various sectors within our community. So, we may be going from 50% to 40% occupancy in various areas within the community. I think that when the governor looks at where is the spread happening and what can we do to kind of limit that spread, there was a lot of question whether this is enough. And so I think it's a step in the right direction. I think it sends the message to people out and about that, this is really serious. And although you can go to the movie theater and go out to eat, it's still out there. And we need to take a step back and start really kind of rolling back our ability to spread the virus. So, here in Arlington specifically, I mean, I could go through the details, but I think it scales back while still allowing businesses to run and to operate. I think when we've always looked at, keeping schools in session and allowing businesses to operate as kind of our two functions that we really want to focus on, and making sure we're tightening up restrictions around keeping those groups those two areas continuing. And so I think that this does a bit of that. It allows us to control the spread while keeping things, running somewhat. And again, like locally, we can look and do further restrictions, and we're always looking at that, and we'll continue to look at that. And so.
Yeah, because it's a tough balance, obviously, between these different priorities. But it does feel also to somebody like myself, just kind of paying attention to this stuff, that wow, the numbers are going up in such an alarming way. And this feels like, yeah, it's a step back, but it's more like a half step back or something. So, I am hopeful. I remain hopeful, as I'm sure lots of people do, that this will be effective. But I wouldn't be surprised, I guess, and maybe Arlingtonians should be aware that you all in town hall may make a decision, may make decisions to take things a little further.
Yeah. I mean, I think it's important though to understand it's hard to make just a decision just here in Arlington without really that regional and that state level participation, because we have borders that people can cross. So it really isn't effective if it's just one community. So I know that the town manager works closely with our regional partners and with the governor as well to urge further restrictions if necessary.
Well, I've already cited, we're closing in on the end of our time here, but I've already cited, that I and we are well aware of how prodigious your own efforts and energy have been devoted to this. But there are so many other people who have been working so hard to keep us all safe and informed, et cetera. And I understand that you'd like to acknowledge those efforts.
Sure. So, I mean, in addition to the leadership team that meets daily, as I mentioned, includes a lot of the department heads from fire and police to the recreation, DPW, planning department, town manager, HR. There's the leadership team has been amazing. Again, meeting daily, reviewing the science, the data, the information available. Obviously the schools are included in that as well. The superintendent meets there with us as well. But I think the additional, group that I'd like to acknowledge is the team here in Health and Human Services. So within the health department, we've got people working literally 24/7, responding to resident needs, whether it's contact tracing, referrals to testing, referrals to whatever necessary to make sure that we can kind of just tamp this down and keep our numbers as low as possible. There's also our partner, Cindy Carn, who works in the school department. We have a lot of overlap with that department, and just making sure that like every case that comes up, we're able to jump on it quickly and to prevent the further spread. So working directly with our liaison in the school, and then the other divisions within Health and Human Services. So there's the Veteran Services, Council on Aging, Arlington Youth Counseling Center, even our Diversity, Equity, and Inclusion Coordinator. I think each aspect of our department has really stepped up, whether it's delivering medication, providing food, just coordinating needs of our community and our human services needs. We've seen, just an amazing team really step up. We've always had that, but just, starting this, kind of jumping into a global pandemic and then just seeing the passion in everybody has been really remarkable, and just a testament to the team that we have here in Health and Human Services. So I did want to recognize them, and I think just across the community, I think we have an amazing staff of employees, whether it's a DPW worker or a rec staff. I think we've just got a really good, solid team of town employees, and I'm really honored to be a part of it, and just excited about as we move forward through the vaccination planning. Just who we're going to pull from various departments, and they're all very excited to step up. So I'm hopeful. So.
Well, thank you for that. Thanks for that acknowledgement. And again, it's like everything else in this conversation, and I know we've got to let you get on with your business, but it's been a comprehensive, thorough, deep look at what is going on in the community. We really appreciate it. And we'll hope to talk to you sometime soon, and hope that the news is even better at that point.
Yeah.
I have been talking to Christine Bongiorno, the director of our Health and Human Services here in Arlington, and basically the expert that we have here around COVID-19. So for this particular update, we got the word right from the source. I'm James Milan. Again, Christine, thanks for joining us. Thank you for joining us out there, and we'll see you next time.